It's Rose, and today I'm going to be doing a video about my anesthesiologist pre-op. So this was before surgery in May, and my surgery was on June 4th. So this was, of course, before surgery. It's just a appointment about the anesthesia and some other stuff. So today I'm going to be talking about that to kind of let you guys know my experience, and yeah, let's get started. So to jump on into it, my parents and I went to my anesthesiologist appointment for the first time. We had never been to this office before. We had never been here because this is my first surgery, so I never had to go to a place like this before. It's just like a regular doctor's office, I think. And actually my dad came, and then just like only my mom could come in with me just because of the stuff that's going on and stuff. So only my mom could come with me in there, or just one parent, but my mom. And then basically we waited, we went back, and then I'm pretty sure we talked to a lot of different people, and they were all asking us just questions and explaining everything to us, nurses and just assistants and all the other people like that. So basically just a bunch of people coming in and out of the room, just talking to us about different things, about incision care, like a lot of different stuff. I actually got the stuff that I had to wash in the night before and the morning of surgery, the antibiotic, or I'm sorry, not antibiotic, the antiseptic cleanser, just to, help get your back all sterilized before surgery. So I actually got that at my anesthesiologist pre-op, but then they did have to, at first they were actually not going to do, draw blood. I know that's, kind of gross, but at first they were not going to have to do that, because it just wasn't something that they thought they were going to have to do. And then they came back and they were like, actually, yeah, we're going to have to. And I was not expecting this because I did not know they were going to be doing that, because they originally weren't. And actually, I think it was because when I was a lot younger, I passed out because I'm kytotic hypoglycemic, so or I was, so I think that's why. But because after we told them that, then they wanted to draw blood to make sure everything was fine, which it is, but we're checking for antibodies and just to make sure everything was healthy, which it was, come to find, so that was good. But yeah, I didn't know they were gonna do that, like I said, and so I had not ate anything before this appointment because it was in the morning, so all I had was some coffee, and I think that made it just 10 times worse. So when they do draw blood, they did it in my arm, I think it was my left arm. So then, they do that, and I closed my eyes because it didn't really hurt, I did not cry, or anything like that. It was done really fast, but it was just that I got so nauseated that I literally almost passed out in there because I got so nauseated. And like I said, I think that was because I had not ate anything, and when my sugar gets really low, I get really nauseated and weak. So I think that was part of the problem, most of it. But the lady that was helping me with the to do to draw the blood, she was really sweet. She was really nice about it. She went to go get some crackers and some ginger ale and to get my sugars back up so I could actually not pass out, because I was this close from passing out. Kind of just blacked out, just went blank and couldn't really see anything, but I could hear, and it was just not really a good experience. I wasn't in pain, but it was just I felt sick. I actually threw up in there, and I had a mask on, so when I threw up, it was just a big old mess. Yeah, but that was kind of my anesthesiologist pre-op. I laugh about it now, but in the moment and in there, I did not feel good. I did not cry. That was the whole bright side of it, but I was sick. So yeah, that was not fun. So that's my anesthesiologist pre-op experience. I'll probably never be in that place again. It was my first time, and it wasn't the people there, of course, everybody was so nice, but it was just the taking blood experience that was not fun, and I rarely ever have had that done, so it just wasn't fun. So anyway, yeah, it's different for everyone, so yours probably will not be like mine, but that was just my experience. So I wanted to kind of talk about that because I get a lot of questions about how was it and what did they tell you and stuff like that. So actually, I had to drink these pre-surgery drinks the night before and the morning of surgery. They gave me three, I think. They gave me two or three. I can't exactly remember. My mom knows. I'm sure she remembers. But it was these pre-surgery drinks that were just kind of like there to help you keep your sugar um, elevated and regulated and stuff because you can't eat like after a certain time before your surgery, the day before and the night before. So I actually got those pre-surgery drinks at the anesthesiologist place doctor's office and the wash that I was supposed to have. So they do like they did give me a couple different things that I would definitely be needing to help, like the drinks that I had to drink and the wash that I had to wash the back and where the incision would be. But I don't know if that's like all anesthesiologist pre-ops or not. That's just what mine was. So I hope this was kind of interesting for you guys to watch. I know it was not like really encouraging, but that's just my story of what happened. So thank y'all for watching, and I will see y'all later.